All right, what's going on, guys? It's Dr. Alex Zayid, and this is the first installation of something that may become the Icons podcast. So we have one of my friends here and another doctor in the Birmingham area. This is Dr. Wadehra, but I will let him go ahead and introduce himself to the podcast.
Yeah, this is awesome. I'm excited to do this. I'm Dr. Wadehra. First name's Ashim. I practice minimally invasive foot surgery and regenerative medicine right here in downtown Birmingham. And it's interesting because you and I started the practices very similar times, right? About a year and a half, 2 years ago.
Yeah.
And I was working for an orthopedic group for the longest time when I came out of my training, and I thought I landed the dream job, but I quickly ran into burnout really fast with just the insurance reimbursements, just poor patients, just overall, it was a volume-based practice. I burned out really, really fast. Long story short, I was trying to find the next, job. What do I do? And I just decided it was probably time to just start my own opportunity. And that's kind of where I started this practice here in Birmingham.
Yeah, no, definitely agree. I think there's more and more of us in medicine that are finding ourselves kind of leaving the traditional path.
Yeah.
And it's not always, it's like a combination of what's good for us and what's good for the patients.
For sure.
So I was in a similar situation, and time after time I'd be in a room with a patient, they'd have a complaint. And in the back of my head, I know the solution. I just can't provide it. And that's because there's not insurance coverage.
Right.
It's not, deemed the gold standard in their eyes.
Right.
And by the way, their eyes are like, a bunch of people that have MBAs, never went to med school, don't understand
100%.
medicine. They just build algorithms that kind of are the path of least resistance for them as the payer. And then, it's just, there's a lot of it's not only burnout of the amount of time that you're spending in the office. It's also just mental fatigue of, man, I'm just saying the same thing over and over again. I'm just pleading to patients hey, I know you should get this medication, but what we need to do before your insurance will pay for this medication is jump through these hoops, do a backflip, document all of it, and then you're still going to have to pay your deductible, and then they'll cover it.
Right.
And at the end of the day, patients, they don't meet anybody from insurance companies.
Never.
They meet you and I. So who do they get mad at?
Us.
Get mad at you and I.
We're the bad guys.
Correct. I mean, how many patients I had tell me you're making so much money off me, you're doing this and that, and I'm like, you have no idea how this breakdown goes. Admittedly, I don't really understand insurance. I don't really understand my own insurance,
right.
And I never cared to because I just understood that is not the appropriate way. Medicine should not be financially guided
Or dictated by somebody else. You went to medical school, you did a residency training, and you're literally dictated by the insurance companies on how to practice medicine.
Correct.
And if you look at an insurance contract, it's 100 pages. Why the heck do I need to read 100 pages to get health insurance? I'm right there with you. I still don't really understand insurance, and you're absolutely correct. I mean, I just read something that by 2030, the average deductible will be $10,000.
Right.
It's insane what's happening. Unfortunately, we heard about what happened to that CEO from United Healthcare. Mm-hmm. Patients are becoming very angry with the way insurance is run in our country, and it's unfortunate. But there are definitely better ways to help patients, as you know. I mean, you're doing it right here at Icon, and I'm very much about this model. I treat the patient with whatever's best that may or may not be covered by the insurance company. Right.
And I think that's the best thing is just being transparent. Hey, Jim, this is what. This is your desired outcome. This is the way to get there, the fastest and safest way possible. The downside, Jim, is XYZ 1, 2, 3. So I've just completely eliminated insurances from the equation, and I just go, hey, this is it. It's a fee-for-service situation, and I encourage people to. Unfortunately, you have to have insurance.
Yeah.
It's not a. I don't know. I mean, it's not a smart thing at the moment to not have insurance. God forbid you get into an accident or you get a life-threatening illness or chronic disease. I mean, you have to have it. But I think that there are models out there that serve patients that are looking for more of a concierge-type care from their day-to-day physician or specialist, and then have that insurance in the background if they end up in an emergency room, get a cancer diagnosis, something of the sort. But you're not the only one. I mean, something that kind of sparked my interest in making this conversation that you and I are having into a mini series is I have so many friends that are physicians in different specialties that are just getting killed by insurance on a day-to-day basis. I mean, I have friends that are surgeons in hospital networks, And something that was just floated, and I think retracted right away, was a limitation on how much time they would provide anesthesia for cosmetic surgeries. Which is wild, because that basically puts your physician in a place that they have to choose to rush a surgery.
Sure.
Right? Or anesthesia is going to leave.
Sure. They're
going to be out. Or the patient's going to have to pay an absurd amount of like cash coverage for anesthesia, which who's the patient going to get mad at? You know, they're going to be like, Dr. Wadehra, why don't you do it faster?
Right.
Not thinking that faster is not better. Faster is a rushed procedure.
Right.
So a lot of logic goes out of the window from the patient's behalf, because they are emotional and they're mad, and it's, you know, the problem is the bill gets sent to them like 3 months after the procedure. So when you have a baby, which coming up on one, congratulations.
And yourself.
But when you have, like when we had our first child, we got hit with this like $9,000 bill, I don't know, 1 or 2 months later, which at the time, when you have happy, successful, healthy delivery, you'll pay whatever.
Sure.
But when that bill comes 2 months later, you're like, what the heck? This is crazy. And patients are the same. If you go do an amazing surgery on somebody, they get this bill 3 months later. They're like, man, you should have just done it an hour faster. You should have rushed it. But they're not, So it's a tough process. So tell us a little bit about what you do that's maybe outside of the run-of-the-mill podiatry, foot and ankle surgery type practice.
No, good question. So what I do is a little unique. I practice a technique known as minimal incision or minimally invasive foot surgery, and you maybe resonate with this. Nowadays, with surgery, whether it's general surgery, orthopedics, what have you, a lot of things are done under what we call a minimal incision, right, approach now. Small incisions, faster recovery, less postoperative complications. And again, head to toe, spinal surgeons, plastic surgeons, general surgeons, we're all doing through a small incision. Well, now we've brought the approach to the foot. And so what I do is I do all of my procedures in my office under a local anesthetic, kind of like going to a dentist for a filling, right? And I fix bunions, which are just big, big bulges on the side of the foot, hammer toes, heel spur removals, etc., through a really tiny incision, done under a local anesthetic in our surgical suite in our office. And the great thing about this technique is that the patient gets to walk the same day in a little surgical shoe. There's no scars whatsoever, so aesthetically the closure is really pleasing, more of a plastic type of closure. And I always joke with patients, but it's true. People want to look their best head to toe now, right? Literally, even on their feet. So you eliminate the risk of a DVT or a blood clot, which can be life-threatening because they walk the same day. Because the incision is, I say it's about 3 millimeters or 1/8 of an inch. Or I usually will do this. I'll take a pen and say, look at the tip of the pen right there. If you see the tip of that pen, that's the insides of that incision I make on the foot. I call it a poke now. We don't really call them incisions, and very seldom do I even use sutures nowadays. But anyways, long story short, you fix the deformity for the patient. They walk the same day. Again, beautiful aesthetic closure, no risk of blood clot, or very seldom do you see blood clot. And then at the same time, very minimal risk of infection. But in my world, foot and ankle, the biggest complaint you hear is the downtime. Most patients that have traditional foot and ankle surgery, they're off their foot for 6 to 8 weeks completely, right? And then they have to then transition to maybe some sort of walking boot, followed by some sort of physical therapy. And usually, it's not unheard of, but it usually takes about a year and a half to recover from whatever procedure they had. We've eliminated that. I mean, I'm 4 weeks in a little post-op shoe, which is like a sandal, transition them right back to a regular shoe at that point. And because they're moving, because there's no locking of the joints, things are moving, everything's supple, that in and of itself is physical therapy. So very seldom do I even send my patients to physical therapy post-surgery. And then we have a whole regenerative medicine side that we do as well. Non-surgical modalities, do a lot of stem cell injections, PRP, Wharton's jelly, etc. Very similar. I know you do very similar things. Yep. A lot of laser therapy and such. So my whole philosophy for what I do is very holistic. Nothing that's again pharmaceutical based. I'm not a big believer in pushing narcotics on patients. Medications with a lot of side effects. I'm all about recovery to the fastest way possible. That's healthy for the patient. That's not harmful. And again, we live in an era now where we can't afford downtime. We're all very busy people.
Yeah.
Young women that have kids, they can't afford to be off their foot for 6 to 8 weeks. I completely resonate with that. So for me, it's really gratifying to see patients that are coming in with very bad deformities. They're embarrassed with the way their feet look. And we can completely transform that with again, very minimal downtime, very minimal pain, swelling, etc.
Yeah. No, that's a huge one. And I think people look at what you do and some of what I do, and they think it is just about downtime or, the aesthetic approach with the scars, but they don't understand doing these awake or local anesthesia type procedures.
Yeah,
The number one thing for guys like you and I is safety,
for sure.
right? So
For sure.
general anesthesia is not a benign process,
Not at all.
right? You and I have probably heard of so many unfortunate situations, and so that's one aspect. Anytime you have something minimally invasive, like you said, your risk of infection just decreases. The fact that a patient can walk out of the procedure on their own and
Yeah.
not be on bed rest for 2, 3, 4 days, that risk of blood clot just decreases by such a large percentage.
Yeah.
Safety's got to be number one at the forefront of all things that we do, even before looking for an aesthetic closure and a really good scar.
Right.
But that being said, I mean, a really large part of my practice is dealing with surgical scars.
Yep.
People will have to get either a cosmetic or medically indicated procedure,
Yep.
but they're left with this scar in the same way you talked about people feeling self-conscious maybe about their feet.
Mm-hmm.
These people will have a scar maybe on the back of their arm, or they'll have, a scar in their abdomen that they are insecure about. They have vacation coming up
Yep.
in about a year that they're looking forward to, or a wedding or something, and they want this addressed.
Yeah.
And it takes a lot of work. So really the whole, crux of the way that I approach medicine is prevention.
Yeah.
So what's
Yeah.
the best way to prevent a scar is don't create one.
Absolutely.
Right. And treating a scar is a very, very, very difficult process. So guys like you that are giving patients the opportunity and have the ability to do something that's truly minimally invasive, I think that's awesome. And I love that patients have that option. That's why I've been sending so many people to you.
No, I appreciate that. And I definitely have a lot of patients that need to come see you as well.
Yeah. So tell me more about the regenerative stuff. Talk about stem cells, because stem cells is, in my opinion, going to be kind of the hottest phrase in the next 5 years in both aesthetic, general, and surgical medicine.
Yeah, and I hate to say this, but as you probably know, FDA does not approve of stem cell therapy, right? And I use more of a product known as Wharton's Jelly, right? Wharton's Jelly product comes from the umbilical cord of live, healthy babies. I always need to preface that, because every time I talk about this with patients, they always ask, well, these babies alive? Are they aborted?
Non-aborted fetuses.
No, these are live, healthy, planned C-section babies. And just to really simplify what Wharton's Jelly is, it's basically a cushioning around the umbilical arteries and veins, essentially, right?
Yep.
And if you look at the science, the fluid itself, the jelly itself, it has a plethora of mesenchymal stem cells, the big hot buzzword that everyone talks about. But if you look at it even more, loaded with hyaluronic acid, cytokines, growth factors, right? And when you utilize that in aesthetics, right, or any sort of inflammatory cascade, whether it's post-surgery, injury, etc., you're essentially giving that body best chance it has to really heal itself. Versus, and again, in my world, oftentimes you go see a doctor, and I'm usually like a second or third opinion for patients. And I'm going to use heel pain for an example, right? Oftentimes these patients are going to go and they're going to get what's known as a cortisone injection. Why? Because that's what the insurance will cover most often.
Correct.
But what patients don't understand with cortisone is it's oftentimes more of a Band-Aid approach to fixing things. And I hear
With
it all
side effects.
Oh, with side effects, of course, But the biggest thing I hear is, Doc, it only worked for about a week or a month, and it came right back, and now it came back with vengeance. Why is that? Well, I'll tell you why. Again, when you use cortisone, there's an anti-inflammatory effect, but the problem with cortisone, again, I'm going to use heel pain, for example, something known as plantar fasciitis, right? Plantar fasciitis is just medical jargon for bad heel pain, a ligament on the bottom of the foot, where if you look at it under a microscope, there's micro tearing that's occurring, essentially. So you hit it with cortisone, and all we're doing is just throwing a Band-Aid at the patient. I hit that mic. Okay. And so oftentimes when the cortisone wears off, the patient's left with more pain because we haven't addressed the root cause. And they keep walking on it. They keep doing the same activities that are causing problems. When you hit it with something like a biologic, something known as Wharton's Jelly, what we're doing is we're giving the body the exact components it needs to really start healing itself, right?
Well, to recreate.
To recreate, right? And so with Wharton's Jelly, very, very specifically, it helps with cushioning. It helps with basically tensile strength. We're really trying to fill those gaps. And the easiest analogy I use with patients is, imagine I punch the wall and I create a hole. What do? We go to Home Depot, Lowe's, we get ourselves a little drywall patch kit, and we patch it back up and we put paint on it. That's exactly what we're going to do with Wharton's Jelly. We put it exactly where it needs to be. The body uses those components and starts patching up the problem, whether it's broken bone, just had surgery, torn ligament, etc. Versus cortisone, which is just a Band-Aid approach.
Correct.
And then patients essentially, the body gets used to it, and now you've done 3-4 injections yearly. And to your point, right, it's not safe for the patient either.
Right.
Cortisone really can, from a hormone perspective, right, can really mess with hormones. But then, at a localized, looking at it where it was injected, I've seen tendons get worse because of that, right? Atrophy, right? You see atrophy. Certain areas of the body you can't even inject cortisone, like
Yeah, that takes us back to the beginning of the convo. Why are insurance companies recommending something that is not only not effective but harmful to patients, and it's cost? It's just
Absolutely
the cheapest.
cost.
It's the cheapest. It's really the quickest thing you could offer them in the office, by the way.
Absolutely.
So if you are like a lazy doctor and you just want to pump through patients,
Right.
you love this. You'll get X amount of dollars a shot, but long term it's not doing much for patients. But yeah, back to stem cells. I use the word recreate because I think it's important for patients to understand we're recreating this ligament, this tendon.
Right.
We're not repairing.
We're not repairing.
All of these other modalities are really just like decreasing the inflammation and working to repair something that was broken. So back to your wall analogy, going to Home Depot, we're using the same materials. We are recreating that wall.
Exactly.
Rather than just putting some tape over it or putting a painting or something over it just to cover it
Band-Aid.
and make it look better, a Band-Aid.
Right.
And right now in aesthetics, we are working towards stem cells. So I'm actually working with a company called Acorn.
Okay.
But the way that we harvest is actually through hair follicles. And what they'll do is they'll take these hair follicles and they will recreate them into something called a secretome, which right now is approved for topical use. But in time, in the world of aesthetics, you will see these stem cells being injected into the face, and then we'll transfer over to IVs and to more regenerative medicine.
Yeah.
But what we're doing is we're recreating those cells that will give you this tighter, brighter skin, the same way that you're able to regenerate these ligaments.
Yep.
And I think that's the coolest part of medicine. I think
love it.
we are kind of like at the bottom of Mount Everest of what is about to be the coolest era in medicine.
Agreed.
One sec, my phone's gonna start blowing up. Hold on.
Go do your thing.
Because hours. Let me just put it on silent. You got a video. Anyways, are we still going? Yeah. Okay. Before I was so rudely interrupted by our patients. Anyways, yeah. So I think that this is about to be the coolest era of medicine once we get into stem cells. But the biggest barrier is going to be the FDA, right? So tinfoil hat time.
Yeah.
For all the conspiracy theorists, which is me. Why? What's the reason for the barrier, right? Why are they preventing these treatments that we as physicians and so many different practitioners in different fields know will work, right? So I'm huge into peptides. I'm huge into hormones. I'm huge into these treatments that really are pretty cost effective. The risk is like slim to none or very, very, very low.
Of course.
But the patient outcomes are phenomenal. People look their best. They feel their best. They're performing at optimal levels, but they are not taking cholesterol medications. And they're not taking blood pressure medications, and they're not taking diabetic medications.
Right.
So who's like not benefiting? I think it's really important for patients to understand when something is not FDA approved. To me, that doesn't mean much. The FDA is a bought and sold for program, company, association.
They're 50 years behind.
Correct.
They're so utilizing trying to practice with what the FDA approves is completely backwards in this country, right? And again, I'll be very transparent about that. I don't know. With what if you truly practice, again, it's kind of like the insurance model, right? If you only do what they say is approved, you're really missing out on what you can do for your patients. And I hope patients understand that too. Because I will get some patients that'll say, "Doc, I think this is more experimental," and you're absolutely correct. There is, but anecdotally, but there's also literature out there, right? And you've seen it with your patients.
Yeah.
Utilizing these type of modalities, biologics.
I don't think there's anything that we're doing that we haven't done a very deep dive on.
Of course.
Right? But
no, of course.
I don't think patients understand what an FDA approval is. I don't think they understand what goes into an FDA approval. I don't think they understand the kind of like the hoops you got to jump through to get an FDA approval. And I don't think they understand the backdoor deals that go into FDA approval. So if you are a patient and you're listening to this, I think that you should look into how many really big pharmaceutical companies have board members that came from the FDA.
Oh, yeah.
Shortly after a drug had gotten pushed through the FDA cycle and gotten approved.
Yep.
So, like, let's say there's a drug called the quartz pill, whatever it might be. And this quartz pill is supposed to cure dementia. Mm-hmm. And somehow it fast tracks through all 4 stages through the FDA approval process, and it goes live and it's on the market. 2 years later, a member from the Quartz Pharmaceutical Company, or a member from the FDA, is now a chair member, the COO of the company that released this pill. And he's making $15 million a year.
Yeah.
It's really hard for me to not think that there was some sort of guarantee from the big pharma company to this person to say, hey, if you fast track this and you cut some corners and you get us live and you get us an approval, we'll guarantee you have a board seat or a job with us when it's not as conspicuous about 12 to 18 months down the road. And honestly, it sounds crazy, but do your homework. It's happened like well over 10 times in the past decade, right? So
sure.
It happens all the time. Unfortunately, this is America. And I am like the ultimate capitalist. I love that. I love a free capital market, but it does open the door for corruption, right? And that's just,
For sure.
Medicine is not free of that the same way politics isn't, local government, big government, whatever you might call it. And unfortunately, us as doctors, we feel it. And we have very little to do with anything that's going on in that world. We're just in these small clinics. We're in front of patients. And we're just doing our best to treat them. But I'm always asked that, is this FDA approved? And my response to them is, do you know how many things have been FDA approved and then revoked 90 days later? Of
course.
Happens all the time. I think it's like 20% of things that get FDA approvals are then revoked down the line. So okay, this is not like a precise science that we have.
Not at all.
And there are so many things that have never even been attempted to go through the FDA approval process that work phenomenally.
Because of all the hoops you need to jump through.
Yeah, it's not worth it for some companies. I mean, there are companies that take a drug and they know the intended purpose, but they just find the path of least resistance to get that FDA approved label that allows us as doctors to use it off label.
Right.
So the biggest hoop to like go through, like for example, some of these stem cell companies that I work with don't have an FDA approval.
Sure.
Which means that is not something that I can use in this clinic. I can use it if I'm practicing outside of the United States, which I hope to do it in some capacity.
Yeah.
But in the United States, I cannot use this product or this medication on a patient. Whereas if it has an FDA approval to treat like warts, but I want to use it to make your lips bigger for some way, I can use it legally, but it's an off-label use.
Yep.
So that's why companies all they care about is just getting that FDA approved label.
Sure.
And that just shows you it's a game.
It is a game.
They're not even getting it to market for what they know is the intended purpose. So many men take a pill called Propecia to make sure that their hair doesn't fall out. Well, this is an FDA approved medication to make sure that your prostate doesn't get enlarged.
Yeah.
So I don't think 21-year-old guys are taking this pill worried about their prostate. But again, there's so many backdoor things that I don't think patients understand. But I get asked the FDA approved thing almost every single day.
All the time.
And then now I've just kind of stopped because it's like I don't have time to go through the whole process with patients. I just tell patients, listen, I treat every single person that's sitting in my chair like you're my brother, like you're my dad, like you're my mom, like you're my sister, like you're my wife.
Yeah.
If I would do this for my wife, I would do it for my patient. If I wouldn't do it for my wife, I wouldn't do it for my patient. And that goes from an aesthetic approach. Like, I'm not going to make your lips bigger than your face. I'm not going to have your cheeks sticking out to the moon. And I'm not going to put something in your body that I wouldn't put in mine. And I'm very vocal about all the things I take. If you follow me on Instagram, you'll see all of the different supplements that I take. I mean, I put my morning and night routine on there all the time. Just yesterday, I had a gentleman that was starting testosterone injections. He was like worried about the needle. I was like, hey, I'm due for mine. Let me go draw mine up.
We'll do it together.
Yeah, watch me do it.
Cool.
You'll see how easy it is.
That's cool.
And I took it right in front of him, and I'm allowed to do that. I'm not I don't hide much. I'm very transparent because once again, I believe in, I trust, and I know that I've done the due diligence and the things that we're doing. I don't need the FDA to tell me I'm a good doctor.
I 100%.
So
100%.
I think more conversations that young doctors like me and you have and continue to have, and we'll do this like more and more, just educating patients on what is out there, like what can they look forward to. And another thing that I do is, and I bet you're the exact same way, sometimes like older doctors hate the whole Google doctor thing. I love it. I basically, during a consultation, I'll have like a young lady sitting in front of me or an older one, whatever it might be, and I'll tell them, hey, these are like the 3 things that I forecast you and I are going to be doing over the next year. I'll talk about some regenerative medicine injectables. I'll talk about some procedures like awake lipo. I'll talk about all these things, and I'll say, your homework, go home, go on Instagram, go on TikTok, go on Google, go on Real Self, go on Reddit. I want you to read the horror stories about all of these things. And then after you read the horror stories, I want you to make sure you find some home run stories. You know, find somebody that got sculpture that had a terrible experience. Find somebody that literally says they're a decade younger. Write down all your questions, bring them to me. Because I don't want to sell a patient.
For sure.
I want a patient to do their research, and I want them to come in optimistic, feeling good to go, feeling ready to do this procedure. Because as you guys know, FedEx dropping off a package. As you guys, or you know, the outcome, the way a patient comes into a procedure is how they're going to leave it.
Absolutely.
You know, when you have those super high anxious patients and they're skeptical and they're not ready to go. I mean, I've called off procedures same day.
Again, you're doing what's best for the patient at the same time.
Go home, feel comfortable. I want you to really understand what it is that we're doing. So I love the Google doctors, but at the same time, they also have to understand when I'm answering your questions, there is, you know, there's about 15 years of education and experience that is behind these answers versus your like 48-hour deep dive on TikTok.
Google search or WebMD, right?
Correct. Well, WebMD is like, oh my gosh, they might be the worst.
No, I'm totally with you. And you know, for my approach, not a lot of people have heard of minimal incision foot surgery, right? So I always get patients that come in, they're very skeptical. Well, how is it that you're able to walk the same day? You know, I had this foot done 15 years ago. I know what I went through. It was a terrible recovery. I'm not sure about this. And I tell them, I go, look, did you do your homework before coming? Did you go to my website? Did you look at all the videos, a plethora of YouTube videos that we have on this procedure? Again, I'm the same way. I don't want to sell anyone on this. You should go do your homework and go listen to the horror stories, like to your point, right? But then also listen to all the success stories.
Right.
You know, if you go on our website, theartoffoot.com, by the way, you can see all the testimonials, video testimonials from our patients. And I always tell my patients, I go, look, I'm not here to sell this to you. Go read all of our wonderful reviews. Go look at all our YouTube videos. Go look at our testimonials that really kind of highlight why this procedure is a game changer for what I do. And again, like you said, I've had patients where I called it off the same day as well, where I don't feel comfortable working on a very anxious patient.
Right.
And so, you know, you're absolutely correct. You know, the way they leave is the way they're going to feel, right? You know, at the time of the procedure. So I've definitely called off procedures on patients because they're just not ready. Yeah.
And part of the thing of like doing something that's a little more on like the forefront, like minimally invasive, I'll do all awake procedures in my office, is sometimes a little bit hard to find information.
Yeah.
Right. So something that I'm really working on is encouraging patients to have the idea of like doing testimonials.
Yeah.
Right. Like yesterday, I had 3 consultations back to back, and I just knew that these were going to be home runs. So I just asked the ladies, I was like, hey, you don't have to commit to anything now, but can we get some footage today before your procedure and talk about what we're doing? Because I do think that this is going to be just a grand slam result, you know, some liposuction cases. And if everything goes good after the fact, will you do another testimonial? Because I have other women that really want to do this. They're like, there's no way I can be awake while you're doing lipo.
Yeah.
And I'm like, do you know how safe that is? Like, if I'm ever getting an elective procedure, I don't want to go under. You know, I just went and did another guy that will be on the podcast, Dr. Sayel. I just did a consultation with him to get some work done with my nose. And I was like, can I just be awake? He's like, are you crazy? And I was like, no, I know that's like a wild ask, but if I could just stay awake throughout the whole thing and never go under, I would prefer that. Now, there is a time and place for general anesthesia, obviously, but if you don't need to, why do it? But it is harder to find, right? So I always tell people, here's like some information on past patients that I've had. And I've been fortunate enough that I have some patients that are brave enough to kind of like get on camera, talk about their experience. But I think that in the age of social media, people will get more comfortable with that.
Of course.
I always ask patients like, hey, educationally, can we take some videos in the procedure, talk about what it is that we're doing? Because this will just help so many other people down the line to be comfortable with that. So for patients that are okay with that, you guys mean a lot to our practice. Like,
for sure,
testimonials are huge. It's really hard to get in my space because everybody wants to be so naturally young and beautiful. And that's a big part of what I do. You still are naturally young and beautiful. You're just more young and more beautiful, you know? So, what else did you want to touch on?
I want to ask you this, because it sounds like, you know, you and I, who's your ideal patient?
Oh man, My ideal patient is somebody that wants to meet me halfway. And that's for every single aspect of what I do, because as Americans, more than any other culture in the world, everybody is looking for the easy button. They're looking for the fastest and quickest and easiest way out. The magic pill.
Where you get abs the next day.
Yeah. And other than liposuction, where you literally have abs the next day. But even in lipo, so like I'll touch on maybe like the top 3 things that we do. I will do injectables in the face. I'll do liposuction, and then I'll do hormone therapy. With all of these things, patients want to come in at noon and they want to leave at 12:30. They want to have spent under $100. They want to have no bruising, no swelling. They want to feel 20 years younger with a six-pack, with high set cheekbones, contoured cheeks, and a perfect jawline. All for under $100, no bruising, no swelling, and they want it in 30 minutes.
Sure.
Because their daughter's wedding is in 48 hours.
You can't deliver that, Alex? Come on, man.
No, it's crazy. I'm working on it. But that's what every patient wants.
Yeah.
So half my day is, I mean, in my consultations, if you sat in them, like my medical assistant now is used to me. I spend the first 10 minutes literally talking you out of a procedure. Listen, you are going to be sore. You're going to be swollen. You're going to be bruised. You're going to miss this. You're going to miss that, blah, blah, blah. Patients are like, okay, you're literally the worst salesperson ever. I'm not a salesperson. My job is to set the realistic expectations. And I show you photos. I have a photo of like, hey, there's a young lady. She's 3 months out. I'm not going to lie. She's never been to the gym once. This is a young man. He's 6 months out, started going to the gym at 4 weeks, started my peptide program, came to the office every X amount of weeks. And this is this result versus this result. So I show people, I go, look, I can make you look good if you do absolutely nothing, but you're looking for great. You're spending time, you're spending money. So meet me halfway. For my peptide and hormone patients that are on the program, I need your diet to be on point. I need you to be consistent with the medication, as crazy as that sounds. People don't take them on time. And I need you to go to the gym, throw around some weights, use your body, and you will look better. You will feel better. For my liposuction patients, I need you to come to every single post-operative appointment. You will look better. You will feel better. You will recover faster. For my aesthetic patients, you just need to understand that this is a process. My best before and afters online are a 6-month process. They're patients that came in. They agreed to basically 90% of what I recommended that they do. They came to all their appointments. They came to the post-procedural appointments. They did things on time, and they have a phenomenal result. The problem is I have women that come in every day and they go, I want this. And I go, great. Just so you know, this person spent like $4,500 over a span of 3 to 6 months, never missed an appointment. And they're like, no, I have a wedding in 2 weeks. And I go, no, you can get a hydrofacial. You can get something minimal. So the issue with patients is that everybody wants maximum results. They want minimum expense, minimum sacrifice, minimum downtime. And that's just not realistic. No. So for a lot of my patients, I go, listen, if you go a block that way or a block that way, they will say yes. They will take, right now I'm renovating a house and I've built a lot in my past. And this is like a common thing with like contractors. You'll have a budget for a house. In your head, you're like, I want to spend $50,000 and renovate my whole house. And you interview 2 contractors. The first contractor comes in. He's really intelligent. He says, we got to do this. We got to move this wall. You're going to have an issue with plumbing. You're going to have an issue with electrical. I'm just telling you straight up. This is a $100,000 job. It is not a $50,000 job. Then you have the next guy that comes to your house. And he walks in. And he just does a quick tour over 3 minutes. He goes, yeah, we could do this for $50,000. Right. Well, let me tell you what ends up happening. If you would have went with the first guy, he would have hit his deadline on time, and you would have ended up spending $99,000, $999, right? He would have been right on budget, right on time, but you're going to spend more than you initially wanted to. Whereas the second guy, you're going to be about 6 to 7 months into your rebuild or renovation. Your budget's already going to be blown by 3 times. And every 2 weeks, he's going to say, oh, we didn't know that this was behind this wall. We didn't know you had an electrical problem. We didn't know you had a plumbing problem. Right. So listen, you're going to find somebody to do your procedure.
Of course. You're
going to find somebody to say yes. Just because they say yes does not mean that that's the right thing to do. Just because they say yes does not mean that they're going to be able to deliver on the outcomes that you're looking for.
Right.
So go to somebody that has an in-depth consultation. Go to somebody that has done this a few times. I mean, don't get me wrong. I've had times where I tell people like, this is what's going to happen because I was excited and I knew and I thought we'd be able to hit it. That's called experience. And I learned, right? I've literally burned myself in procedures. So now I just set the bar very low, Under promise, over deliver.
That's the way to do it. I tell patients the same thing. I go, look, first and foremost, I don't strive for perfection. Better. And
For sure.
And for me, it's a few things. There's a cosmetic appeal to what I do, but really for me, it's functionality and pain free. And I always tell patients, if you feel like a foot model after we're done, that's just icing on the cake for me.
100%.
I never promise a single thing. I never will promise perfection because we don't know. We don't know. Ultimately, at the end of the day, we don't really know the outcome.
Yeah, we're not dealing with mechanical situations.
Right.
These are human bodies. So like, I say that all the time. Say it a little bit different. I do strive for perfection, hoping to really be great. I'm hoping to go from good to great.
Sure.
My office is a little bit different than you. I deal with all healthy patients.
Sure.
Right? So I have people that are coming in that, I'll have a 40-year-old guy, looks really good for 40. Mm-hmm. But he doesn't want to look good for 40. He wants to just look great,
Right.
regardless of age, regardless of demographic.
Yeah.
So, but yeah, we want to get the patients leaving in a better state that they came in.
100%.
That should be the guarantee.
Yeah.
And that's what I always tell patients. I guarantee you're going to look better.
Yeah.
I guarantee you're going to feel better.
Right.
If we can hit this end result that you brought to me, this after photo that you brought, that's sick. That's amazing. And I hope that if we do, you tell all of your friends about me. Never happens, but I hope that you do. Everybody. Do you know how many times my office is in Birmingham? I go out in Birmingham every single weekend. I mean, I've been in restaurants where literally every surrounding table is one of my patients, and nobody will say hi to me. I'm like, I always say I'm everybody's best kept secret.
Well, I'm singing your praises because you and I are starting to share patients now, right?
Yeah,
and so
a lot of fun, by the way.
Absolutely. So I'm certainly sending patients your way.
Yeah.
You could use your
Last week I had or Monday, or I don't know, I think it was Monday, and I'm running late, and my medical assistant's like, you got to go into room 2. She's got to go. She's getting antsy. Go in. Such a nice lady. And I was like, so sorry to keep you late. We're going to make this very quick. I know you have somewhere to be. She's like, yeah, I'm going to see your friend down the street, Dr. Wadehra. And I was like, you know what? I was like, you could be late. Just tell him you were with Dr. Alex, and everything will be good.
No, it was perfectly fine.
I think we're both going to continue to grow in Birmingham. I know eventually, and a really good problem to have, we're both having space issues, which is good. Thank God. Growing practices. And we'll be able to grow alongside each other, and we'll do another one of these and kind of talk about new things that we're going to be offering our patients, new maybe issues that we're seeing in the practice. And I like talking about the issues because patients watch these. I know that patients watch like all my content I put out. And when they hear kind of like our perspective, they're able to give me their perspective. And a lot of times we've been able to meet halfway on like a better solution. I'm rolling out a brand new membership program that literally was designed by these 2 ladies. I had these 2 ladies that had came in, they did their consultations together, and one of them had been traveling overseas and saw this membership program and was like, I love that they did that. Imagine if you did this. And I was like,
that's genius.
I was like, I'm doing it. And she's like, really? I was like, I have no ego. Like, this practice is my baby. Like we were just talking about the other day. Like this practice is my other baby outside of my baby. So the ideas don't need to be mine.
No.
Just like raising your child. Like so many people will help raise your child. Like it takes a village, as they say. My patients are part of that village. My colleagues are part of that village. My mentors are part of that village. And we're just both trying to create a product and a practice and a service that serves you guys in the best possible way. And that in turn helps us make a living and takes care of our families, right? I just think that when you're doing that, the money and the success will follow really good product, a really good service that puts the patients first. So it's been a pleasure. It's been a good time.
Yeah, this was fun.
Yeah, so
We'll do this again.
Want to give a very special shout out to Goat Media, Pierre Bacall. We set this up very, very, very last minute. Came into my office today at like 7 o'clock, set up this podcast. So a lot more to come. Maybe this will become a podcast. Maybe this is a one-off. That's just the way my life kind of goes.
That's how we'll figure it out.
Thanks a lot, man.
Hey, thanks, man. Appreciate it.
Good having you.
It was good.
I got to get tattoos.
Yeah, you got to get tattoos.
That would make me look cooler on the podcast. But my mom wouldn't watch the podcast.